we know that the only health system that's going to actually control our health care costs and provide universal comprehensive coverage is a single-payer system. It gives people the choice of free choice of things that they actually do want, which is your choice of doctor and your choice of treatment. Many of us have to struggle to have our voice heard in the public sector, but you have a very public voice. And so I wonder why single-payer has not been a more prominent part of the discussion among people of your stature who actually recognize that this is the way we can control healthcare costs.
Well, I think in part it's recognizing what Tim is writing about, that this would be dead on arrival in a country where interest groups own the government, and in this particular case, you couldn't get any such thing legislated. There's, of course, my wife is actually the one you should, she is the single-payer person. And she gives a nice talk of, in Taiwan, how that worked, and I think I was the culprit, in fact, part of the suggesting to the Taiwanese, you're not that rich, you can't waste so much money, so start with a single-payer system, see how you like it. If not, you can always change it by opening it up. The problem with single-payer systems that she in her talks has are twofold. One, there's a tendency to underfund those systems.
We don't have that problem here. We already spend enough.
Yeah, but I mean, if it's just in part, Medicare has to keep up with the private sector, but if it were all just single-payer, there is a problem with that. Canada has had this problem, and Taiwan has it. So that is one problem. The other one, disadvantage is if you make a mistake in such a system, it's system-wide. It goes everywhere and it's system-wide, and it's very powerful and fast. The advantages of single-payer, of course, it's an ideal platform for IT. The US is lagging, not in the production. We produce most of the software for IT. But the other countries, Denmark, Taiwan, Japan, they're all using it much more smartly than the US is because we're so fragmented. So you have that as an advantage. So I do believe it should have been debated more. The American people should have gotten the facts before them. They said, do you like this or don't you? It has these strengths, it has these weaknesses, as my wife's beautiful talk all show. But I think the reason it never got any mileage here is the Obama administration looked at it and said, this dead on arrival. We're just going to get killed over this. And Mrs. Clinton once told me that too, that she would have favored the single-payer system. But in fact, President Clinton had said, no, this won't go.
Right,
so, I mean, we seem to be committed not to do it.
And
Unless people of your stature are getting this message out, people don't understand that.
The question's been asked and answered by Professor Reinhardt.